Dr. Chin Sen on the floor. Hi, good afternoon, Dr. Chan. Nice to meet you here. Yeah.
Nice to meet you.
Yeah, we just had a very nice coffee over the booth. In case our participants have not realized, we have a free coffee. Please feel free to explore. Hi, Dr. Chan.
Hi.
So I will be passing the stage to you because I think we had a good chat. Normally in Malaysia, we didn't realize that diabetes could cause a huge impact to our eyes. So me today, together with a lot of fellows audience over here, we want to hear what is your opinion and what is your suggestion, and also share us some demographic about Malaysia. Are we ready?
Yes.
Yeah, the stage
Okay.
is yours. Thank you.
Thank you.
Dr.
Thank you.
Chan.
Thank you so much. Hi, good afternoon, everyone.
Yeah, let's have a seat. It's going to take us 30 minutes, yeah?
I'm Dr. Chan from
Yeah.
Oasis Eye Specialist Setia, Indah. It's a great honor to be invited to have a talk about diabetic eye disease here.
All right, let's go ahead.
Okay. First of all, what is diabetes mellitus? Okay, diabetes mellitus is actually a chronic metabolic disease where there is elevated blood sugar in our body, and this elevated blood sugar causes damage to the blood vessels in our body, where there is the blood vessels of heart, brain, kidneys, and eyes, and etc. So, if the large blood vessels in our body are damaged, for example, the heart will have heart disease such as heart attack. If the blood vessels of the brain is affected, we have stroke. And if there's poor blood circulation, they will impair wound healing, which increases the risk of infection. Similarly, if there's damage of blood vessels, of small blood vessels in our eye, of nerve, and the kidney, it cause loss of function of these organs. If there's loss of function of the nerve, there will be loss of sensation. If there's loss of function of the kidney, for example, it's kidney failure, patient will eventually need dialysis. I will elaborate more on the loss of function of the eye later. So according to the National Health and Morbidity Survey in 2023 in Malaysia, diabetes is one of the top causes of death in Malaysia. 15.6% of adults in Malaysia has diabetes, meaning 1 in 6 adults in Malaysia have diabetes. This is the data in 2023, which is a bit lower than the data in 2019. Okay. 2 in 5 adults with diabetes do not know that they have diabetes. This will lead to poor sugar control, and the percentage is even higher in patients who are younger. For example, for patients who have diabetes in the age group of 18 to 29 years old, 84% of them don't know that they have diabetes. Okay? For patients who have diabetes, more than half of them do not have blood sugar control. This will increase the risk of target end organ damage. How about the economic burden of diabetes in Malaysia? According to the Ministry of Health report for direct healthcare costs of non-communicable disease in Malaysia in 2022, the annual economic burden of diabetes in Malaysia is about 4.4 billion. This amount is higher than the treatment cost for cancer and treatment costs for cardiovascular diseases. However, this is just a tip of iceberg where the indirect costs of economic burden such as loss of productivity, early retirement, and family impact are very hard to calculate. So the red circle shows that this direct health cost for diabetes, which is about 43.7 billion. And it's higher than the treatment for cardiovascular diseases and cancer treatment. So we are going deep into diabetic-related eye disease now. So what is diabetic eye diseases? It's a group of eye condition that affects patients with diabetes. This includes diabetic retinopathy, glaucoma, cataract, retina vein or artery occlusion, and infection. So again, how diabetes can affect your eyes? Diabetes actually can damage the small blood vessels at the back of your eyes, which is the retina, and causes vision loss. So for patients with chronic high blood sugar, it can damage the small blood vessels in the retina, leading to vision loss. Diabetic retinopathy is a leading cause of blindness in working age adults. Generally, diabetic retinopathy are divided into two major stages, the non-proliferative type and the proliferative type, where there's growth of abnormal new vessels in response to poor circulation to the retina. These abnormal vessels are extremely fragile and can bleed anytime, causing sudden vision loss. This is a schematic picture showing on the right side the normal retina, where the blood vessels are normal. In non-proliferative type of diabetic retinopathy, there will be bleeding, small dots of bleeding on the retina, whereas for the proliferative type of diabetic retinopathy, there will be growth of abnormal new vessels on the retina, which look like this. These abnormal blood vessels are extremely fragile and can bleed at any time, causing sudden vision loss. So who is likely to develop diabetic retinopathy? Those patients with long history of diabetes or uncontrolled diabetes, uncontrolled blood sugar level, are in high risk of developing diabetic retinopathy. For patients who are pregnant, due to the change in physiological state and hormonal changes, the progression of diabetic retinopathy is faster and even worse. High blood sugar, high blood cholesterol, and smoking, which damages the blood vessels of retina, can increase the risk of diabetic retinopathy. So what are the symptoms of diabetic retinopathy? At the beginning of the diabetic retinopathy, where there's haven't got any nerve damage or bleeding into the eye, patient may be asymptomatic. There's no symptom on vision, no visual symptom. However, if there's nerve damage or sudden bleeding into the eye, patient may experience blurry of vision, seeing floaters, or dark shape obscuring the vision, trouble seeing colors, dark or empty areas in your vision, or vision loss. This is the normal vision for a patient. However, if there is sudden bleeding into the eye, patient may experience this kind of vision, where there's blood obscuring the visual field. Some patients may experience seeing a black shadow obscuring their visual field, like this. So in diabetic macular edema, there's the damaged vessel, there's a leakage of damaged vessel causing thickening of the retina, which affects the vision. This picture actually shows that the yellow area are the area of diabetic macular edema. So what are the treatment for diabetic retinopathy? The treatment for diabetic retinopathy involves laser treatment and intravitreal anti-VEGF injection, where we inject the drug directly into the eyeball to regress the new vessel to prevent further bleeding into the eye. However, if the bleeding persists or there is presence of retinal detachment, surgery may require to clear the blood and reattach the retina. Okay. Glaucoma is a complication of diabetic retinopathy, where there is nerve damage due to increase in eye pressure. In glaucoma, there is abnormal blood vessel growth on the iris and the abnormal vessels can block the drainage of the fluid in the eye, causing raise in eye pressure and damage the nerve. Treatment for glaucoma usually is a laser treatment to regress the blood vessels and using medication to control the eye pressure. However, if medication is inadequate to control the eye pressure, surgery may be needed. Usually, in diabetic retinopathy, when progress to glaucoma, it's very hard to treat and the prognosis is very poor even with treatment. Patient may progress to permanent vision loss or even blindness with treatment. So this is how the new vessels on the iris look like. And the new vessel on the iris may grow and block the drainage system of fluid in the eye, causing raise in eye pressure. Cataract. Okay. Excessive blood sugar can cause cataract formation. And the treatment for cataract is surgery. However, in patients with pre-existing diabetic retinopathy, even after successful cataract surgery, patient may not regain normal vision. And there's a chance of diabetic retinopathy progression and risk of infection after cataract surgery. So these are the symptoms of cataract, where patients have blurry on the right side of the picture. Patient may have experienced blurry vision, glares, and halos. So retinal vein occlusion in diabetic and other systemic diseases such as high cholesterol and hypertension, there's hardening of the blood vessels, which results in occlusion of the blood vessels. This can cause damage to the retina, and patient may experience sudden vision loss if they have this retinal vein occlusion. If this disease is left untreated, patient may progress to glaucoma and permanent vision loss. So infection. Diabetic patients are more prone to infection due to the reduce in immunity and poor wound healing. About 20% of the patients who have eye infection after cataract surgery had diabetes. And the treatment for eye infection are in the form of antibiotics, where it can be used in the form of eye drops, pills, or intravitreal injection, where we inject the antibiotic directly into the eye. Surgery may be required if the infection cannot be controlled with antibiotics. The infection can cause permanent visual impairment even with treatment. And patients with pre-existing diabetic retinopathy has poorer visual outcome after treatment. So this is a picture showing that there's a pus inside the eye due to infection. So what are the important messages for patients with diabetes? You need to know that diabetes can damage your eyes over time, leading to permanent vision loss or blindness. Okay. Maintain good blood sugar control is important to prevent or delay the diabetic-related eye disease. I always advise patients to control their sugar and also have regular exercise and diet control. For patients with diabetes, it's advised to have regular eye examination to detect any diabetic retinopathy and treat early if necessary. Last but not least, to stop smoking is important to prevent progression of diabetic retinopathy. Thank you.
All right. With that, thank you so much for Dr. Chan. Let's have a big round of applause. Thank you so much, Dr. Chan, for bringing us such an informative briefing. Yeah, so Dr. Chan, I know you have been working in this industry for more than 10 years, almost more than 10 years, right? And you are working with the Oasis specialist in Johor Bahru. So based on your experience, actually on behalf of all the audience, I have probably 3 questions would like to ask you to check whether we can benefit from the talk. So the first one, for me, I do experience that I do have family member, close family member, who had diabetes, right? So if I were allowed to bring them for an eye check, yeah. So I do know that not every optometrist or the such a brand like a Focus Point, not every outlet they have some certain machine that can do some prevention checking on all of the diseases that we mentioned. So before we go visit to this optometrist or the shop or things like that, is there any keyword that we can ask before we go? What kind of machine that we need to tell before we go for checking, Dr. Chen?
Actually, the more important one I think is the fundus photo, because actually by looking at the fundus photo, the retina, it can tell you a lot of findings,
Yeah,
such
gotcha.
as the optic nerve findings, where we can detect glaucoma. If there is any sign of diabetic retinopathy, such as new vessels growth, or there's hemorrhage on the retina, can be detected from the fundus photo. Not just diabetic eye disease, the eye problem, there are other signs of the retina can be detected from the fundus photo as well. So the fundus photo actually can tell us a lot of information about the retina condition, whether the patient has any age-related macular degeneration,
Yeah.
any bleeding on the retina, not just signs of diabetic retinopathy. Any diseases related to retina,
Mm-hmm.
we can see, can be detected from the fundus photo.
All right. So this is a keyword. So for the benefit of the audience, right? Funness photo.
Yes.
How do we spell it to educate for our audience?
The fundus, 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 photo, photo, PHOTO.
Just photo.
Yes.
All right. Funness photo.
Fundus,
Fundus.
FUNDUS.
Right. FUNDUS. So before you visit to optometrists or things like that, make sure you book an appointment and say, hey, I'm looking for this fundus photo. Do you have this machine to help me to do a very rough screening? Probably you will need a second or the third one if, unfortunately, if things happen. But I think that the first gatekeeper for us to make sure we have a clear vision is the fundus photo. Yep. So I hope everyone got it. And so to follow up on the second question, so there is a lot of myth today, different age, right? Population of different age, 18, 20, 30 years old and above. People are always saying that, hey, so such a young age, you won't easily prone to diabetes. I want to check with Dr. Chan, is this statement right or wrong?
Well, for me, I think this statement is not correct.
Oh wow, what isn't
I've been
correct?
seeing quite a lot of young patients who have diabetes, and they came with quite bad diabetic eye problem. For example, bleeding into the eye and very bad vision when they came. The condition is very bad and it's very hard to treat. I have seen a patient who is in their 20s, brought by their father to the hospital with eye problem, complaining very bad vision, and after examining, we found that she has a bleeding into the eye due to proliferative diabetic retinopathy, and the other eye has already have retina detachment.
Right.
So this thing is it has been there for some time. Okay, it takes years or months for that to happen.
Mm-hmm.
So, and it's very hard to treat, and the prognosis is very, very poor. So, we can't say that for young patient, you is very unlikely to have diabetes. This impression for me is not correct.
Yeah.
Patient may not aware,
Mm-hmm.
and the disease at the end the disease might progress to very bad stage.
Yeah, that
When
could
they
be a
when they started
pretty bad
taking
case, huh?
treatment.
Yeah, and also just now I saw doctor has prepared, a statistic showing that the knowledge about diabetes throughout the different age of the demographic and population. So probably the youngster nowadays, they think that we are not prone to diabetes, so we don't care. right? This is a very dangerous thing and very risky thing. I think we need to educate a lot of our audiences in the hall in Mid Valley today. So if you happen to have a family inherited, diabetes, kind of this kind of trend that happened in your family members, I think it is advisable to do a health check. Not talking about the eye itself, but talking primarily on diabetes. So, doctor, I had one last question, if you don't mind. For me, I do regular health checking. I go to hospital, those KBJ or whatsoever hospital. So they will do a blood test and things like that. So in general, for a normal human being, what is the frequency that we need to do this kind of body check? Once a year, is it enough? Or would you recommend some group that is prone to a certain disease to do a more frequent check in that sense, doctor?
In my opinion, I think if, let's say, you have done once and the blood test, everything, and the health checkup is normal,
Yeah.
and it's advisable to do it annually.
So for me, for example, if I will already check everything is normal, normally I check mid of the year. So on the next year, probably on the same time, I will check it again to make sure the pulse is all good.
This is
Right.
should be the ideal way.
This is the ideal way. What about, is there any chances we need to increase the frequency for diabetes patient? Shall we make it more frequent on the blood sugar test or things like that?
For patients with diabetes, usually they will be scheduled for regular follow-up by
Right.
their treating doctors. Depends on the control of the diabetes. If the diabetes level is not controlled well,
Mhm.
and after the doctor stepping up the medications, they usually ask the patient to come back in 2 to 3 months to see if the blood vessels, the blood sugar is already optimized with the new treatment regime.
Right.
And they'll monitor the blood sugar level based on the HbA1c results.
Got it.
Mm.
Right. So I think the last page, if we were allowed to flash the screen again, you did a very good summary for the benefit of the audience that this will be the key important points for all of our audience to take back. Probably if you happen in the second floor, third floor, feel free to snap a photo if you want. And then do visit Focus Point for optometrists and ask for the funders devices funders photo, right? If you want to check the above mentioned diseases. And also, we open the floor to anyone if you are interested to ask maybe one quick question to Dr. Chan since he's here. Anyone would like to have a quick chat? Maybe one or two questions? Yeah? Hi, selamat petang Puan. You have any question? Ada apa-apa pertanyaan untuk Dr. Chan?
Okay. This patient, do you mean for diabetic patient or normal population? Diabetic patient. So usually, for patient who are, usually the diabetic patient, we look more on how the blood sugar, how the response of the blood sugar after meal. Because the fasting blood sugar, patient can fast as long as possible until a normal level. The important is we have to see how the body responds to the raise in the blood sugar after meal. So usually we recommend after meal not more than 10. Okay, it should be controlled not more than 10 after meal. This is a blood sugar control, and we don't want any fluctuation, big fluctuation in blood sugar, like suddenly very high or very low. It's not good to the patient as well. Even with a very low patient with hypoglycemia, there's a chance of progression of diabetic retinopathy. Not just high blood sugar.
Right, thank you, Puan. That is a very good informative question on the behalf of the audience. Yeah. I think for this section, pretty helpful and pretty much that we have shared with the audience. And once again, I want to thank you, Dr. Chan, on the behalf of Focal Point. And let's have a big round of applause. Thank you, Dr. Chan, for coming here
Thank you.
today and spending Wonderful 30 minutes. Yep. Thank you. Thank you so much, Dr. Chen. It's our great pleasure to have you.
Thank you.